and TV Uganda, enlightenment on your hands always.
Ndikiro mudwaliro banjanjabe nenge bitanda bichule ewo tositumbire bantu sikira abantu kuberwanyi nano mubasikola kwatumbire rwanyi ino ni kwahola ateni yahola embewo engodo bekuba kutumbire mula ate sano malwaye kala kusibita kube bangi sokumayina kunakole kutye ndefu becho janje kusikwa Masafu abana kubana berwanyi ino noche bitanda byose bitumbire mundu yebule bamukonyesha asyawo
basamba sense basa
aka batuyambe woti chindi
ametakao
au majakile levotote nikire tolo sisi vi au tusaho nyumbani yeba tusera kwa habere ni kulimukati evo tolire chuli musa yamona chimiri ani nyumba tolo iba kongo kuba kulimo kwesi ano nane mbeho iba nyingi ngenda itulumira ano batu yambe batongereho nyumba kusobola oba mukati nikire mudwaro ndaletera omwana wange alimu omusujja kuhwetusaho ate alo kwetusaho naye nga alimu omusujja kweno kwamaani nanungonereza ano kulu Veranda kutwinda akono kutwere odindidi abantu yimao kona bisana yano simbisya bubihuro bange ndi nompariso nikiro konasi
washo tigamente hese
government ituyambeho tube bitanda wikire mudwaliro babulati bakubere standard abantu mukeka alikuwa kwikiro nako
embeera mu ddwaliro simbi abakyala beetanidde nnyo okuzaalira mu ddwaliro kuba tufuna abakyala bangi nnyo okusingako ne targets ze tulina nga Masafu hospital tufunira ddala abakyala okuva e Namayingo district abamu bava Bugiri abamu bava ne Kenya ne bajja ne bazaala wano era buli mwezi tuzaalisa abakyala nga 300 ate nga mu target yaffe tulina okuzaalisa abakyala nga 160 naye era tusukkawo abalwadde baagala nnyo okuzaalira mu ddwaliro bajja naye eddwaliro tulinamu obuzibuzibu nga ffe kati nga wano ku woodi twesanga nti okusinziira ku nnamba y'abakyala woodi yo ntono department eno gye tuyita labor suit wano wenyini wetuyimiridde we bazaalira tulinayo obutanda 2 bwokka we bazaalirako akokusatu nako weekali naye tekali mu mbeera nnungi nnyo naye tukakozesa ebintu ebirala ng'okunaaza abakyala mu lubuto aba bavuddemu embuto kale general space si nnungi ate ebitanda nabyo tebitumala bulungi ebitanda 2 byokka ne weesanga abakyala bali 5 sometimes nga bali kuzaala at the same time kati abakyala abamu twesanga nga bazaalidde ne wansi kale nekitubeera nga tekituyisa bulungi nga ffe abasawo okulaba abakyala baffe nga bazaalira mu mbeera bwetyo
kesa ezo zifuna
asinza gamba nti tuyinza okufiirwa omukyala lwakuba space ntono fe abasawo weetuli tukola ogwaffe naye kiba nti kuzaalikiza omukyala wansi tumuzaalikizaawo omukyala okufa nti lwakuba space ntono naye embeera gye bayitamu of course si nnungi basobola okufuna obulwadde nga bi-infections ebyo azaalidde wansi n'afuna infection oluusi omukyala yakazaalira ku kitanda avaako bw'ati ne tusaako omulala omukyala nga tetunakirongoosa bulungi oluusi asobola okufunirawo infection naye ebyo eba bakyala okufa nedda omukyala bw'atuuka nga anaatera ng'ebiseera bye ebyokuzaala binaatera otuuka n'atuuka oluusi atuuka n'awita eddakiika ntono yo n'azaala ffe kyetukola wano tulina mama kits zo mama kits ate tubadde tukyayinawo tulina akaveera kati waba tusenga ebitanda byonna bijjudde tutunulamu ne tulaba webeerayo omukyala ng'abadde anaatera naye ng'eddakiika zikyaliko tusobola omugjayo ne tuteekako ekiveera ne tumukolerako awo naye kiba tekisobose nga alina okuzaalirawo waali era just tukozesa akaveera ka mama kit n'azaalirako tetumutuma nti ate genda oleeta omukeeka aba talina na budde buleeta omukeeka naye abamu bajja nga bavudde ewaka nga beetegese nga basituddeyo akakeeka kaabwe basituddeyo leesu zaabwe naye byonna bituyamba.
Masafu General Hospital, as earlier alluded, has grown from Health Center 3 to Health Center 4, and then with the support from Ministry of Health and funding from JICA was upgraded to health to general hospital level. And it has, from the time it became a general hospital service, scope has grown, and the population that we serve has equally grown over a period of time. You know, the challenges with the increased quality of service is increased population of patients, which of course eventually has an effect on the quality of service still. I'll give an example. About 3 years ago, we used to have about 100 deliveries a month, but as it stands now, we are close to 220 per month. We deliver an average of 8 to 12 mothers every day. With that, we also have additional referrals that keep coming in from our other health centers in Busia and our neighbors in Namaingo district that do not have a district or a general hospital. Now that brings along congestion, because the space that was constructed has remained the same, the number of beds that fit there remain the same. So we get challenged that out of these 10 mothers delivered a day, you find there are others who have been operated that have to stay for longer than a day or for longer than 2 days. So meaning we are forced to have some others, especially those that have delivered normally, sleeping on the floor, which of course is also risky that they can easily get infections as they sleep on the floor. Or sometimes you may be forced to discharge those that underwent cesarean section earlier than planned, because we need space for new patients. And the other challenge is sometimes we are forced, when the referral comes, we push the referral further because we do not have space. And this comes along with other challenges. We don't know what happens along the way. As there are delays in service delivery, you're referring a mother to Mbale because of space. The baby may be affected. The mother may have more complications because of delayed service. Now, along with that, we are still challenged with the staffing. Masafu General Hospital is staffed at 32%. So that means either the staff that are available will work beyond their capacity that has been assigned, or we are likely to be forced to compromise on the quality of service, because we want to catch up with the service to everyone that has actually come to us. Aside from the maternity, the other place that is usually challenged with space is the newborn intensive care unit, where we take care of our sick newborn babies and prematures. It is a small space that we improvise, that idea should have had like 3 babies. But sometimes we have up to 22 babies, because many of them are referrals from Namaingo and the center 3s that do not offer this service well within Busia. So with that congestion, serving them becomes very difficult. The staffing is already low. Sometimes you want to refer them beyond. They are referred from a center 3 to you. You want to refer them to Mbale. They reject the referral because they are scared of many things and also are financially constrained. So as hospital management, we thought we have to harness all available opportunities. So we said resources find whoever is prepared. So I was tasked by the hospital board to look for all the necessary plans. So we contacted the Ministry of Health, got all the BOQs, engineering or building drawings in preparation for any possibility of funding. We know that the district health office receives about 200 to 300 million every year. The money called PHC development. This money is supposed to cater for all health facilities, renovations, minor constructions. But what we need is a bigger investment that we may not actually afford from the district health office. Because our plans, I think, for the new constructions are estimated to be at around 4.8 billion shillings, which is about 20 times what the district health office receives a year. So the only options we have is one, either we receive money from Ministry of Finance through Ministry of Health using the ad hoc format, or we may still get a blessing from any supportive donors. We know that people can afford these monies in this country. So whoever feels touched by our situation and feels like they are able to help us, the help is really actually very much welcome to support our babies and mothers in this quest for quality of maternal and newborn health services in Masafu General Hospital. That supports both Busia and Amayingo and part of Bujiri as well. My message to the general public is one of the reasons why hospitals or health facilities suffer is because of burden of disease. And like has always been the message, prevention is better than cure. Probably, if we were taking on the cheaper and cost-friendly preventive measures, we would actually cut on our chances or our number of times that we actually visit our health facilities. And of course, by implication, this cuts on the costs that we actually undertake in offering these health services. And then the community plays a very important role. They are our eyes and ears out there to tell us how well our services are moving, to motivate us to do better, but also where things are not going well. Negative feedback is equally very important for us to improve. So they should not sit back and relax. Whatever thing does not go well, they should always inform us so that we improve. It benefits them as well as it benefits us. And we shall offer them the better service that they deserve with their support as well. Okay. And then to any other well-wisher, like I said, the challenges I know, like for the infrastructure, if we have any well-wishers, either political, whether business community, our own government, we wish to have this infrastructure improved to serve our population better. I've seen other hospitals that we have received, I think, multi-billion renovations and the upgrades, like Busole Hospital, Bujiri Hospital. I think Masafu Hospital, it is high time we also got this. We are so deserving as well, because we are trying our best to serve the population in our districts and the neighboring districts as much as possible.
Mama Edward Olifulino Elie Masafu saisi nonga doli bona efwe mu district mononi Edward Olikwesika omuntu nalwalo tulebusime yetse Masafu nendo webuteba yesi yetse Masafu naino lyewunja twalero kuli nende x-ray yaletebwa naye batayi installinga itata akibo wanjo emirimo mama sibasinjana hano habere ngotudira hawo esonga inasembeyo niyo eward Maternity ward mudwaro lyefalino esakasi abulani limumbera kitali nasala habadawe bamama befe betusaho ne babani batirawo bafune bidinyi byamani muno kusaba ebindu bifana bitokulirana kunyasobanga kukesa olugano befolwo na madidi ako hasinda bitawo bano yabange ndaho basima muno era ndaho basimire lallani munabani mufunye mirembe naremwe Muzei Museveni Neke sababu raundo na wanyama Richard Hamalo musichete na saya barambere mbaba sinende mbere to